Hello, this is the first video in the LIPIX training program. Today we are going to cover logging in and conducting an initial patient search. To enter the login page, you will simply go to the login, which is lipixportal.org, enter your username and password, and click the login button. At that point, you will be taken to a page where we conduct what is known as a second factor authentication. At this point, a passcode will be sent to your cell phone via text message. That text message will arrive within a few seconds, and once it does, all you have to do is enter it into the passcode field. In this case, I just received my passcode, and I will enter it, which is 289 7734. Now also on this page you have the option of certifying a computer for a period of time. For clinicians in the field, we have the option for them to certify the computer for up to 1 year. At that point, for demonstration purposes, I am not going to do that right now. After you enter your code, you hit the submit button. At this point, you'll be taken to the LIPIX initial patient search page. Once you get to the patient search page, what we will do then is enter the information that we have on the patient. At this point, the more information you enter, the more targeted the results will be for the patients that you're looking for. So in this case, I'm going to enter the patient last name Perry, first name Kevin, and I know the birth date, so I'll enter that as 1983 08/24. So once you enter the information in, click the search button. At this point, we will pull in all of the records that are relevant to this individual. So in this case, we can see that we have 2 Kevin Perrys under the first LIPIX ID number and a 3rd Kevin Perry under a 2nd LIPIX ID number. The reason we have 2 LIPIX ID numbers is that, based on criteria we're evaluating the individual records as, we determine whether or not we believe those records are related. In certain cases, such as this one, you'll see it appears that they are the same individual, but we have identified them as being potentially different. We err on the side of caution with that, so a clinician will be looking at the most accurate data. Now, at this point, a clinician has the option of selecting all of those records to look at if they deem that it is the same individual. While I'm on this page, I also want to go over a few other things. We have over here on the right side these document types. They cover various types of data available within each of the patient records. So in this case, we have allergies, other documentation, radiology reports. The second icon shows us that we have medication data. Third one shows that we have lab reports and also radiological reports. Also, while on this page, note that at the top it says that some records have been filtered due to consent settings. In certain situations, such as an emergency, clinicians can override consent policies. By doing so, they simply have to enter the reason. In this case, I'm going to simply put emergency and authorized by self. This is audited to make sure that there's no abuse of the override. Once clicking that, you'll then see that under the first LIPIX ID number, we now have 3 records as opposed to 2, and the note that some records have been filtered has gone away. Now, as I mentioned earlier, if a clinician deems all of these patients to be the same, they can simply select the check boxes for all the patients and click the search patient button. At that point, they'll get a notice that says, warning, we've selected patients with multiple LIPIX ID numbers. Are you sure it's the same individual? In this case, since we would click OK. At that point, we'll be taken to the search results screen, and that concludes the first portion of our training session. Thank you.